Hello everyone, I am physiotherapist Volkan from Livelifetaller. Today I am with my patient Rahul and we do the lengthening with the 11 method. And right now we are over 6 centimeter and we're gonna talk about his process and how his life going on in here. So let's start with this, Rahul. Why did you do the surgery?
So initially I came here for medical purpose, which was asymmetrical limb. And when I came here and they run the tests, unfortunately the second, so I came from the right leg, which was shorter. And unfortunately, after I've done the tests, I run the tests, they advised me that the left leg will require adjustment as well. And because of my femur was always very short, didn't develop, my muscles, they were very congested. I had issues with, even if I stretch, I had always issues with my muscles, tightness, and that caused back pain, knee pain. So we decided to, go for the lengthening process and try to, stretch and lengthen the femur. And by doing this, obviously, I'm gonna gain some height as well.
Okay, and now continue with your mobilization and capable to movements and your general elasticity. First, I want to ask you this. What is the exercise you hate most in the physios? Or the stretch or the exercise or the thing we do?
So obviously, stretching, yeah. Stretching is very hard. When you get to certain point, becomes very difficult and very painful sometimes. So yeah, I would say stretching. Overall physiotherapy is very relaxing. Massaging and using equipment. But when it's about stretching, it gets a little bit harder. Obviously, I stretch in my room 4 or 5 times a day, just to keep my muscle flexible. But yeah, I would say the stretching. The physiotherapy sessions, the stretching is more intense. So yeah, I would say that's the hardest part.
And the second thing I want to ask is, can you give me an example that you observe by yourself during the process that get better with physiotherapist assistance?
Obviously, mobility, like joint pain or like, for example, knee pain, you're working on my knee, I have a little bit tension. So by, using equipment, the pain considerably reduced in the next day after the physiotherapy. But yeah, I would say, the great equipments, which targeting every single area, even for lordosis, back pain. There are equipment that, I had these issues. That's why I'm talking about this. And, they will like fix it in 1 or 2 days. So, the back pain gone. So I can focus on my journey.
And what is your favorite equipment that we use in here that will helpful to you?
I would say the massage. It's not the equipment,
Yeah.
it's the actual manual physiotherapy.
Manual
like that.
physiotherapy,
Yeah. I would say this equipment. I would.
So you think generally
yeah.
equipments are more take an action as support, but the main thing is held by manual therapy.
Yes, the manual therapy. Yes.
Yeah. And if you defined your physiotherapy sessions within 3 words, what will be these 3 words gonna be?
In 3 words.
Yeah, it's a bit tricky question.
Yeah, it is. Have to move forward.
Okay, more than a little bit 3, but it's fine. I get the point.
Yeah, I would just, yeah, it's 3, it's 4, yeah. But I would say in the best words, it just help to move forward. Without physiotherapy, we won't be able to push forward.
When you look back, what kind of progress you proud of yourself mostly?
By not, quitting the process, pushing forward, working hard, listen to the medical team, to the physio team, to the nutritionist. Yeah, so this is the, makes me proud.
It's also happy to hear that because you always like a soldier for me too. You did every exercise and everything that I always tell you, so which
Yeah.
keep your condition stable and even good to compare the starting.
How you stay motivated? I think it's more about, you as an individual. I've been always very motivated. I never quit in my life. I never push back. I'm always looking forward. I think it's about you as a person. I don't have like something necessary that helped me to do this. It's just my mentality.
So you didn't any time that you want to quit?
There was moments, but very short. But then, as I will look back and I say, like, no, I'm not gonna do it. I'm a fighter, and I'm not gonna quit anything in life.
As you know, during this process, nutrition is also very important to keep you in a good form and healthy way. So, what did your experiences with the nutrition? How did you manage this survey?
So obviously, we had a nutritionist visiting every single week, maybe like two to three times per week, having conversation, giving advices, how I stay on top of nutrition. Obviously, try to eat as much healthy as possible. I'm trying to eat because sometimes you don't have the appetite, but you still have to push. For the days I don't feel my appetite is great, I just purchase myself a blender, and I'm just like putting like veggies,
Everything you
fruits,
want.
yeah, or even like protein shakes, and try to get my calories intake. I would say the blender helped me a lot to stay on top of it, because sometimes you really feel that you don't want to eat, but you have to.
Okay, as you said, during this period, nutrition is very important because how much if we deal with the muscles, their elasticity and the strength, you need to feed those guys. So by feeding them healthy, you need to take support from the nutrition. And also during this period, one of the most important thing is bone healing. So keep your bone healing in a good state, or maybe increasing your healing capacity, also related with the nutrition. So for further information and for the further talking, we will take support from our nutritionist, Meltem.
Hello everyone, I am the dietitian Meltem. Today I'm with a patient and let's talk about your nutrition during this process. I'm going to ask you some questions. Was it hard for you to stick on a diet that we planned?
A little bit at the beginning, because after got discharged from the hospital, it was like 1 or 2 weeks where your mobility it's not there where it should be. It's very hard to move around, and that was the point when we have the kitchen. You can order food from there, but you can't do like extra things for yourself. So it's very hard, but then when I managed to gain my mobility after 2 weeks onwards, it was pretty easy to stick to the diet.
When the swelling gone also,
And when the swelling gone,
you felt better and you start preparing something for you, right?
Yeah.
Okay, and also you made some smoothies, some different smoothies in your room, and so far you stay consistent the diet. What was the motivation? What it's come from?
Obviously, I'm here for a reason, and the only way to it's not an easy process, obviously. And the only way to go through this process, you need to stay consistent, and you need to have a good diet, in order to reach the goal. Yeah, so probably that was the motivation, reaching the goal and getting back on on your feet.
You are here for a reason,
Yeah.
and you just dream the final, maybe, right?
Yeah.
Okay, good. Did you ever feel like your mood or your energy changed depends on what you ate?
Yes, of course, because you can't compare, when you eat, a salad with the chicken, your energy increases. Compared with, if you eat junk foods, you order, from McDonald's, stuff like that, your energy decreases, your mood might strike, because obviously sometimes we crave, fast food, so you might be happy at the moment, but later on, if you don't stick to the diet and you eat junk food, your energy just go down, and obviously your mood is going down as well.
Mm-hmm.
Yeah.
It maybe make you feel better, but just for a short term,
For
right?
a short period of time, yeah.
And it's like an addiction. You want to eat more and more every time.
Yeah.
Okay, but you are still doing lengthening. Is there any foods that make you feel better? A food or a snack?
Let's say, because you mentioned about the smoothies, yes, I do all kind of smoothies, from green smoothies, but I think my favorite, the protein shakes, because you can put everything you want. You can put oats, you can put banana, you can put peanut butter, you can put honey, and it's very easy to get to digest. And I would say this because the most of the there are periods when you don't feel like you want to eat, but you have to. But if you get a smoothie with all the nutrition, it's just very easy. Yeah. So you get your calorie intake.
And I want to add something also. One of our goals with you to prevent the loss of weight. I mean, too much weight. Maintain your current weight even from before the surgery. I think that smoothies helped a lot to you also.
Yeah. Because I lost, I think, after our first checkup, and on the second checkup, I lost quite a lot of weight. And then after having a conversation and talking about nutrition and the smoothies and the stuff that I can put in the smoothie, I think helped me a lot, because now we can see that my weight just stayed there where it should be and didn't go down as well.
Yes, at least we just maintain it.
Yeah, maintain it. Yeah.
Okay. Do you think eating healthy help your recovery process? Make it faster or
yeah,
better?
100%. Yeah, 100%.
Okay.
I think it's one of the key points, the nutrition.
And bone healing is
And
also
bone healing,
good?
yeah, of course. Yeah,
Okay.
because nutrition helps with the bone healing, and my bone healing is very good. So yeah, it helps.
Okay. At the beginning, I think.
Yes,
right?
at the beginning, and then I got my own blender, and I can order parsley, I can order a lot of stuff, but in the beginning help a lot. Yeah, it helped a lot with the swallowing, reducing the swallowing and inflammation, and they're very helpful.
Which one is your favorite? I mean, as a taste and as in ingredients.
This is my favorite, because this is what those are ingredients I use for my smoothies. Usually. So yeah, that's my favorite.
And it tastes so fresh.
Yes,
right?
it's very refreshing, and now it's very hot outside. Then they're very refreshing. You feel way better after you drink.
Okay.
No, I try to stay on top of my nutrition even back home. I used to work out, but it was very hard for me because of my issue with the leg. As I said, I have limb discrepancy, and by correcting this, I will be able to do more than I used to do before. And yes, but usually I try to stay healthy, not only here but back home as well, and getting the supplements I need, the food, and obviously sometimes you need to get supplements to support with a healthy life.
And here, of course, I recommend something, but not only for this process, not only for limb lengthening, something I'm saying. Of course, this diet is a little bit different, and you need to get more nutrients and calories anyway, but for the general health, actually, we need to follow a good and healthy diet. We are using some supplements to support healing process, because it should be as a combination, foods and supplements together. Normally, the magnesium supplement we are using, especially in femur lengthening, but we start to use with you a little bit earlier, because maybe you want to say that.
Yes, we started a little bit earlier because of the muscle cramps, and contractions, and in, let's say, a week or 2 weeks time since I started to take magnesium, the cramps gone, and I'm almost at the end of my journey, and since then I never had any muscle cramps.
But this process always like some kind of pain comes. Sometimes we can solve that problem, but another kind of pain maybe comes again, right?
Yeah.
Always
It's like a roller coaster. You know, you wake up in the morning, you feel better, and then during the day, because you have to be active. Yeah, in order to recover well, you have to be active, and then you get tired, and you get joint pains, or maybe you get pin pain. But everything can be sorted, with a medical team. And for the pin pain, for example, ice packs and stuff like that, they help a lot. And if not, medication and stuff like this. But yes, it's always something, but it's not something major that stop you by going forward, because you pretty much have everything you need here to push yourself. You have the medical team, we have you with the nutrition, we have the physio, and it's pretty much everything to get your journey to the end and in a safe way.
Okay, now we know food's important for the recovery, but this process brings some pain and also discomfort. So let's talk about that part with the medical team.
Hello everyone, my name is Ömer. I'm medical team manager at Livelifetaller. Today I'm with my patient. I'm going to change to his bandages. While I'm changing it, I'm going to ask him some of the questions. Okay, Mr. Roll. Today I'm going to change to your bandages, as I said, then I'm going to ask you some of the questions. How was your first 10 to 15 days after operation? What about the pain? Do you was expecting or not? How was your process, first 10 days?
So obviously straight after the operation, when I woke up, I felt a little bit pain, but then the medical team from the hospital, they came straight away and they gave me painkillers, so I didn't pretty much felt nothing during my stay on a hospital. And the next 10 days, I can say that was a little bit harder to move, but the medical team and the physiotherapy team helped me a lot to get better and put myself back on the feet, so I can do the normal, stuff. The normal daily stuff.
Because of the, your wounds was so fresh, also you was having some swelling because of the operation.
Yeah.
And the post-op days usually is like that. And especially you get LOM femur, that was causing also to moving. It was so difficult first 10 to 15 days, I know. What about the sleeping?
For the first 10 days, my sleep was not that bad. I started to get a little bit struggle once I started to get deeper into the process and keep lengthening. I lost very quick my glute muscle, and then because obviously you can't use different position than standing, I was a little bit struggle, but that was only for a couple of weeks. After get better, because obviously I was attending every week physiotherapy, which helped me a lot, and the medical team, some medication, and after that was getting better, and now I can say that I'm very deep into the process and I can sleep 7-8 hours.
More than me. That's nice. That's nice.
And I think more than Volkan. I think he sleeps the less.
Probably also. Have you get any infection during the process? And also, how was the skin tension and skin pain after you started to do in lengthening, especially first days?
In a very early stages, I had a little bit pin pain, but not major. But that was sorted with, was melted down with ice packs, with some painkillers. But there was nothing major in terms of infections. No infection whatsoever. The wounds are very, very, very good. I had bandage changing every 5 days, and every single day the medical team would come to my room 2 times per day, and they would also check the wounds.
Bandages.
Yeah, the bandages.
Yeah, he never had any infection until this time, hopefully. And also, we are almost end of the lengthening right now.
Yeah.
How many centimeters you have left? Currently?
Just let's say 1.5. Yeah.
10 to 15 days later, you're gonna get removal operation,
Yeah.
and you never get any infection during the process with LON femur, especially with that open wounds. Also, I want to ask you some of the questions about the medications. You never had any experience about the medications before, as I know your medical history. How was the medication scheduled first days after operation? How many times you was using medications, and how was your experience about this?
Obviously, as you mentioned, from my medical history, I never had any surgeries or things that I had to pretty much get into a routine with medication to stick to it. So the beginning was a bit difficult, but I had to put alarms every single time when I had to take medication. Obviously, you need to take stomach protection straight away in the morning. Just protect your stomach from, like taking the pills and affecting your stomach lately. A blood thinner, which you have to take it every single day because your mobility is not great. So your blood has to stay thin. And then obviously some painkillers here and there. I didn't go very crazy with the painkillers. Only when I had the pain, only when the pain was a little bit over the threshold. But I try to don't go very crazy with this. Now, obviously, that I am very deep into the process, I'm taking medication for nerve pain. But apart from this, no other issues and no other medication that I had to take, which is very basic.
Basic painkillers.
Yeah.
By the way, you chose the LON femur with the fixator method. How was your experience about that fixators?
Yeah, obviously not very comfortable. You only have one position, only lay on your back. You can't use different position for sleep. So as I said, was a little bit difficult at the beginning. And then obviously I used to it. I didn't have any major issues. They're a bit heavy. Obviously, you carry a little bit weight, but during the process, you pretty much used to it. As you already mentioned, I had no infections, no skin issues, only a little bit of pin pain, but apart from this, nothing else. So I can say that the experience with the LON, it wasn't that bad for me. Yes, obviously, as I already mentioned earlier, we have the medical team visiting us in the morning first time, and then in the afternoon. If any questions on any medication is needed, they support with. Also, they're always on the phone. If you need any help during the day, you can reach out to them, and easy one of them, they come to your room, or they respond very, very quick.
I'm so happy about his journey. Yes, it was so difficult on the first days because of the glutes. He couldn't sleep a couple of times. After that, we started to give it to him some of the sleeping medications, I mean melatonin. He took some support from outside also. But right now, he's feeling great. He's sleeping 8 to 9 hours per day, and he never had any infection. This is a really success story. His journey is almost done, by the way. He's gonna move to operation room again in the next 10 to 15 days to remove his fixators. After that, we're gonna do again consultation with him, like on the first days, blood test, x-rays. Dr. Halil will be gonna see him. Then he will gonna move his home country to enjoy with his new height.
This is the main camera.
Can you repeat? Because we discussed this question.